I'm Dr. Christopher McCann. I'm a gynecologic oncologist here at the HCA Florida Institute for Gynecologic Oncology. So a DO is very similar to MD, except that we approach the medical field sort of involving the whole body. There's a small part of osteopathic training that also deals with manipulative medicine, so similar to a chiropractor. As far as my practice, in the operating room, I do a lot of minimally invasive surgery for not only gynecologic cancer, but also sort of difficult, just benign gynecologic conditions, and especially focusing on robotics, which has really taken off in our field over the past probably 10 years. A thing that makes my practice a little unique is that we do outpatient hysterectomies, even for endometrial cancer patients. So patients don't have to stay in the hospital, they're able to go home the same day. And that's not something that's done very often, especially in this area. My personal approach, how I try to want to treat my patients would be how I would treat my own family. Being in women's health, how I would treat my mother, or my wife, or my daughter. I would expect honesty, so I'm very honest with my patients. In the cancer world, sometimes that's difficult, to be honest, because sometimes you don't have very good news. But I think that that's extremely important. The thing I love most about my practice is the ability to help patients through a difficult time. I enjoy being in the operating room, and my practice is primarily a surgical practice. And I like to be able to stay involved with my patients after they have surgery, if they need adjuvant therapy, including chemotherapy and radiation. So trying to allow for continuity of care.